Getting down a high obstacle is easier than getting up. However, it is still a more advanced skill. Many wheelchair users have as much trouble with anxiety and fear about getting down a curb as physically being able to do it. We'll work through some of the strategies to manage this important and valuable skill. We can use both a backward and forward approach for getting down an obstacle. Make sure that you have a spotter who is physically able to prevent a tip before you practice this skill. Going down an obstacle backwards is the preferred and safer approach when you have assistance. You may need to move the anti-tippers into the up position or remove them. Wheel the chair backwards towards the edge of the obstacle. The spotter should stand on the lower surface, close to the wheelchair, and the wheelchair user should shift their weight towards the casters, leaning forward slightly. Do not tip the wheelchair into a wheelie position, as this can create a jarring drop which may injure the wheelchair user or damage the chair. Instead, slowly roll the drive wheels over the edge of the obstacle and gently down to the lower surface. Now the chair may be put into a partial wheelie position by pushing down on the tipper bar with one foot and pulling back on the push handles. Slowly and carefully lower the front casters onto the ground using the push handles and the tipper bar to control the descent. If the obstacle is fairly small, you may go down in a forward position. Larger obstacles increase the risk of a forwards tip or the footrest getting stuck. The wheelchair user should wheel forwards towards the edge of the obstacle and then shift their weight backwards in the chair. The spotter can slowly push the chair forwards, first rolling the casters over the edge down to the lower surface, and then rolling the drive wheels over and down, ensuring they do not lift the chair.